Okay, so let's look at the lower limb. So we have the connection of the femur to the pelvis, and this connects at the acetabulum. So we could talk about the hip joint, like we talked about the shoulder joints, which is also a ball and socket. So this is where the head of the femur articulates with, so it comes together. The head of the femur articulates with the acetabulum on the coxal bone. So unlike the shoulder, this is actually a very deep articulation, and there's actually lots of ligaments and tendons, which are connective tissue that help to hold the femur into the pelvis. So it is more uncommon for you to have a dislocated hip than for you to have a dislocated shoulder. So it's kind of interesting when we look at this hip joint. Sometimes they talk about having a broken hip. And a broken hip is actually not a broken hip joint or even a broken pelvis. It is actually a broken femur. So it's actually a misnomer. So if we look at a broken hip, this is actually a fracture in the femur, and usually it is in the neck of the femur. So that is associated with falling in older individuals. They might fall down and break their hip. Or interestingly, they now think that perhaps their femur in older people can get so brittle that it can, with weight bearing, can actually break and then the person falls. And so it's like, which comes first? Whether the hip or the femur breaks first and causes the fall, or whether they fall and then they break their femur. So the other structures here include the knee joint. And so we have this connection with the femur distally to the tibia. So remember, distal is further away, proximal is closer in. So distally, it connects to the tibia. You'll notice here that the fibula is not connected to, or does not have a joint with the femur. So the femur articulates with the patella, which is a special bone that protects the front of the kneecap, and then the tibia, which is part of the lower leg. So let's look at those. Okay, so the femur we're going to talk about this knee joint in more detail in a lecture coming up soon. So the tibia and the fibula are actually very much like the radius and the ulna in the forearm. So they would be kind of homologous evolutionarily, because they come from very similar structures. So when we look at the fibula, you'll notice that the fibula actually articulates with the tibia. And it articulates with the tibia laterally. So remember, medial versus lateral. So it is on the side. So let's look at another image of this. So this is my fibula right here. And this is my tibia, very similar to the radius and the ulna. Now you might ask, well, which side is lateral? That would be the side of your pinky toe, and this would be your hallux or your big toe. And so interestingly, when we look at the distal articulations and the distal structures on the tibia and fibula, these are actually the knobs of the tibia and the fibula. So those knobs that you have on the side of your ankle are not actually ankle bones, but they're actually the tibia and the fibula. We talked about that in the wrist too. Those knobs that you have are actually the radius and the ulna. So when we look at this articulation at the foot, we see that the tibia and the fibula articulate with one of the tarsal bones that is called the talus. So we have from the tibia and the fibula, continuing distally, we have the talus. So the talus and the calcaneus are two bones that you need to know, and they are examples of, and maybe I can make this smaller, of metatarsals. And I just read on a room there, that would be one word. Metatarsals, not metatarsals. Caught myself here. This would be an example of tarsals. So let's, tarsals, like carpals, right, in the wrist. So there's other tarsal bones here, but the talus is an important one. And then you do not need to know the other types of tarsals. But then we have the main portion of the foot, the bottom of the foot and the front of the foot, the top of the foot. That would be the metatarsals. So then we have metatarsals, metatarsals, and just like in the hand, we have phalanges. The big toe is actually called the hallux. So like your thumb was called the pollex, your big toe is called the hallux. So this is my big toe. So let's look at these in more detail. Your calcaneus bone is located right here. That is your heel bone. Your talus bone articulates with the tibia to make up that part of that ankle joint. And then we have the rest of these tarsals here. Then we have the metatarsals, which are long bones, shaped wise. And then we have the phalanges. Right? And then the big toe is medial to the body in anatomical position.